Hi, I'm Sandra Barrington, and welcome to Doc Talk. This is a series where we bring local physicians to you to learn a little bit more about their experience, their background, the services they offer in the community, and maybe a little bit about what the future of healthcare in Nevada County looks like for them. And today we have a very exciting guest, a fairly new physician to our community, our new general surgeon, Dr. Khan. Welcome.
Hi, Sandra. Thank you for having me over.
Yeah, thank you for joining us today. I know you have a busy surgery schedule and a couple more today, so we'll just jump right into it.
Sounds good.
Yeah, so can you share a little bit about your educational experience and what got you to this point in your career?
Sure. So I went to med school in Pakistan. That's where I was born and raised. And then I moved to the U.S. I did my residency in Chicago. I was at the University of Illinois. I spent almost 7 years there, and then after that, I moved to upstate New York. I was with the University of Rochester as their academic general surgeon for 5 years. Great.
Yeah. And what made you choose surgery? There's a lot of different elements of medicine you can go into, a lot of specialties. What is it about surgery that you enjoy?
I think that's one of the most common questions that I get asked, even with my friends asking about these things. But my dad was a surgeon.
Oh, wow.
So I think that was one of the influences I had in med school. I really enjoyed operating. It's one of the specialties that I can actually feel we make a difference. It's patients come in interested bodies, and we are the ones that actually can go in and fix things and have instantaneous results.
Mm-hmm. Great, yeah. And can you share a little bit about what exactly a general surgeon does versus maybe like an orthopedic surgeon or whatnot?
So a general surgeon, as the word implies, that we do a lot of different surgeries and on a lot of different parts of the body. Anything from the thyroid down to the breast, abdomen, gallbladder, intestines, large intestine, hemorrhoids, lipomas, and a lot of different cancers too, at different parts of the body.
Okay. Is there a particular thing you would say you specialize in when it comes to surgery?
So I really enjoy colorectal surgery.
Okay.
So a lot of colon cancer that I've dealt with in the past, but especially ever since I came to the community, I've had a lot of patients that had colon cancer or colon lesions that we ended up doing minimally invasive surgery, laparoscopic surgery, and that's what I'm advocating for, because that's new technology that's out there. Patients recover better, faster, and then they go back to their lives sooner.
Yeah, and one of the things we like to do at the foundation is support and fund things that will keep people close to home for their care. So we did support a lot of things in the surgery department recently with a campaign to bring new technology and resources in. What would you say maybe are some of the things that we couldn't do before that now that we have you, that the community has access to, that they wouldn't have to go out of the area for?
A lot of laparoscopic surgery. So I do kind of specialize in laparoscopic and minimally invasive surgery, and that includes hernias, that includes gallbladders, that includes abdominal cancer operations, and small incisions. Patients end up staying in the hospital for maybe a day and then go home. Also, I try to use new technology for all the breast cancer patients too. So we're using a lot of newer technology, newer devices for the breast cancer diagnosis as well as treatment.
Wonderful. Yeah, we have an amazing cancer center in our community, and you're a big part of supporting those patients. So
we're blessed to have the cancer center.
Yeah, thank you. Thank you. And so tell us a little bit about what you think the future of surgical care in Grass Valley might be.
We have a very good established system in Grass Valley. The hospital is beautiful. It has all the essential tools we need. With our previous surgeon, Dr. Boyle, being in the community and myself joining the practice, the goal is to keep the patients local, to provide them with the best care possible, the more advanced care possible. And what my eventual goal would be to, as you mentioned earlier, to keep the patients local. I don't want them traveling an hour and a half, and to get treatment that they can get close to home.
Great. So we've been talking a lot at the foundation about, and within the hospital, about the future of surgical robotics in our community, and looking out, some years from now, if that's possible, if that makes sense. What are your thoughts on surgical robotics?
So in my previous practice, I use robot very regularly, and that's something which it's a known fact that robot is gonna be part of the newer surgeon practice. We have enough data and evidence that shows robotic surgery it helps with the disease management, helps the surgeons with their surgery. One of the misconceptions people usually have is the robot is doing the surgery. It's basically the surgeon does it. It's more precision that the robot gives us. And that's something which, if we eventually get into the community, that will significantly improve the surgical outcomes for the patients.
Yeah, well, we're excited about that possibility and advocating for that as well.
Thank you.
So, well, thank you for joining us today. It was great to learn a little bit more about you and your expertise. And thank you for joining us for Doc Talk. You can find us at supportsierranevada.org or at Nevada County Media.